find you, sir?
Good to see you.
Good to see you.
Hi, Bruce. How are you? We ready?
Yeah.
Sit down, everybody.
We'd like to, first of all, welcome you, Mr. President, to Kansas City, the great state of Missouri, the Show Me State, the great city of Kansas City, the Mayor Emmanuel Cleaver, and our congressional district of Karen McCarthy, the best place in the world to be, as you will note. And we are very thankful to have you here to come and work with us and discuss the challenges and the accomplishments that we've made here in Kansas City. And so we're so proud to have you here.
Thank you. Well, let me thank you, Clyde and Gail and Congresswoman McCarthy and Mayor Cleveland, and to all of you who have come here. I was with some of you back in 1994 to talk about what Missouri was doing, and I wanted to come back because, as all of you know, the welfare system is about to change nationwide. And I have worked very hard in the last 4 years to help people move from welfare to work. There are nearly 2 million fewer people on welfare today than there were the day I became president. And we've done it by working with states and giving them waivers from federal rules. But this new welfare reform law fundamentally changes the bargain. It basically says we will continue to guarantee to every person on welfare health care, food for the children and the family, child care if they go to work. But what used to come in the monthly check will now be given to the state, either to continue as a monthly check or to be used in some other way to move into the workplace. Then the states have to meet very stiff requirements on getting jobs for people. And I'm convinced that the only way the states are going to be able to really move large numbers of people to work in a short time is with a partnership with the private sector, doing what Missouri has done, using what used to be the welfare check or a food stamp check as an income supplement to a private employer who can then engage in training and work and do what you've done. And before I'm going over to speak to the Southern Governors Association, which Governor Carnahan is hosting here, to talk to these governors about what they have to do now. But before I did, I wanted to come back here and listen to all of you and thank you, those of you who've moved from welfare to work, and thank the employers for being involved in this program, but also to emphasize to the American people and to the press and through them to the American people what has to happen next. As I've said repeatedly, the whole debate on welfare in Washington was largely a political debate until this law was signed. And I'm sure when you read in the newspaper, saw in the evening news, some of the things that were said, it didn't strike you as particularly real based on your own experience. It just, a lot of it was politics. But the politics is over now. The law's changed, and the states and the communities now have a responsibility to create a story like yours for every able-bodied person on welfare in America. That's basically what this law says. And we've got to have help from employers or we can't make it. So it's very exciting to me. And let me just make one other point about this. I really believe, and that's why I wanted you to have a chance to tell your story to the country, thanks to the help of these people who are with us here. I really believe that what we should want for people who've hit a rough spot in their life and don't have much income is what we want for all American families. What we want is for people to be able to succeed in raising their children and to be able to succeed in the workplace. And if our country has to make a choice between one or the other, we're going to be in trouble. Everybody's most important job is raising their kids. But if the economy doesn't work, we're in trouble. And if we have to give up raising our kids to make the economy work, we're in trouble. So to me, welfare reform is part of a larger agenda to help all Americans succeed at work and at home. We lowered taxes for the lowest income working people in 1993, 15 million of them, so that they wouldn't have any incentive to fall back on welfare. We've tried to help people with immunizing their children and in a whole range of other areas. And one thing that's become unfortunately controversial again the last couple of days, the first bill I signed was the Family and Medical Leave Law, which basically says you don't lose your job if you take some time off when a baby's born or a parent's sick. I think it should be expanded in a limited way to let people go to parent-teacher conferences or regular doctor's appointments with their kids But I certainly don't think it should be repealed. I think that would be a mistake, because what we're trying to do, again, is to create an environment in which people can succeed at home and at work. And I'm trying to take all these issues out of politics, if I can, and get them down to people. So that's why I'm glad to be here. That's why I thank you for letting me come. And Clyde, why don't you go on with the program, and maybe we'll all learn a lot about what you're doing here.
Well, one of the key things that is critical is a person going to work, and so we've got a couple of former welfare recipients who are now enjoying the value of work and want to talk to you about what it meant to them and what happened through this program. And Bradella Smith is one of our first welfare recipients. So Bradella, why don't you, ex-AFTC recipients, why don't you tell the president? That's right.
I think it's been great, and this is a great thing. I'm glad that they're doing a lot more now than they did when I first started. When I first started, none of this was offered to me, but I've seen a lot of people that are on this program are benefiting from it. And I see what it's doing to the environment where we live. Our children, they look up to us now. When they see something that they can strive for, instead of thinking that we have to sit at home all day long and do nothing, to live off of welfare. So this is really great. If we can get more companies and corporations involved in this project, this will help a lot. And definitely our men. It's time we start with our men. We need to get our men in these kind of programs.
I want to come back to that, but what services did you get from this program?
Well, I got the job training to upgrade my high school level, to get my grade level back up to standard. So when I did get into a job, I would qualify for certain positions. So, and that helped me out a lot.
And did you benefit from this wage supplement program that Missouri does, do you know?
So she came
did.
before.
Yeah, I was one of the first
Right.
to join into the program when it first started out. So they didn't have all of what they have today. Then when I first started, it was to get me into schooling, pay for my child care, make sure I had bus fare to and back and forth to there. It was like a job to me, getting up and going to school every day. And then get me into job training program.
And you made us a comment about how it was important to get the men involved.
Right.
Let me just say, I mean, maybe everyone in the press knows this, but let me emphasize. The reason that's important in terms of what they're doing here in Missouri and what we can do under welfare reform is that, with certain rare exceptions, some states cover two-parent households with welfare. But basically, single men cannot get welfare in America. So if they get any income supplement, it's something they get from the state. What they have been getting from the federal government is food stamps. And if they're able-bodied, that's been cut back. But what Missouri's doing is taking the food stamps income that men could get, along with the welfare income that women could get, and making them both available as supplements to employers if they will hire people either off welfare or idle men who are only getting food stamps. And so this state has really done, I think, a remarkable job of trying to use all the tools available to it.
Mr. President, Shara Burris is one of the persons who worked on the wage supplement program and is now working on a job and receiving that supplement. So maybe, Shara, you might tell him how that daycare, how those benefits have actually helped you.
Well, my husband takes care of my kid. I never had to have daycare. That's a blessing. We have a handicapped child, so that's a blessing. And I work at Aero Cleaners, and it's helped me a lot in the 2 years I've been there.
So you've had this job for 2 years.
It'll be 2 years February 20th. And it's a blessing for the program I'm in. I think they should get a lot more people in it. It helped me when I needed it. I don't need it no more. So somebody else can get it to help somebody else move along into the world.
How did you feel when you started? How did you feel it was helping you? What did you think was the most helpful thing?
Be employed. Didn't have to be on welfare no more. Welfare helped me when I needed it, but I like being more employed now. Get better things in life.
Mr. President, Kathy Romero, who is another former welfare recipient, she is special. I had a throat constriction and almost choked to death, and she admitted me into the hospital. Thank God she was trained real well. But she was able to assist, and she's been now as the Assistant Admissions Director for one of our local hospitals here, and as a former welfare recipient.
As for Dell, I was one of the first ones to join the programs. I was through the teachers program. I have been off of welfare and I've worked 4.5 years now. At the time, just like for Dell, we didn't have a lot of things offered to us when we started the program. I, like her, did have a transportation fee and a child care fee. But after we went to work, we were cut off food stamps and our child care and our Medicaid. And that was probably the hardest thing getting into the workforce is the health insurance. Health insurance is very, very expensive. And I can see as to where a lot of people would be intimidated not to want to go to work. If they found out how much health insurance costs, they would probably have a second thought about trying to work.
Well, now under this welfare reform bill, you know, we can leave people with their Medicaid health insurance for a year, maybe more. And also with, if their jobs pay a low enough income, they can also get food stamp supplements. And we have a lot more money for child care than we did before. Now, it's conceivable we could run out of child care money, but if we do, it'll be what I would call a high-class problem. If we run out of child care money, it'll be because we've had so many good employers who've taken people, and, you know, and I think the Congress would probably help us some then, because they just, you know, we got the money that we thought we would need based on what we thought we could do in placing people in work. But so you think that the health insurance cost is one of the main things that deters people from moving into work, don't you?
Yeah, I mean, because when you're on state aid and you have Medicaid, I don't think a lot of people realize what goes into health care as far as what prescriptions cost, what doctor visits cost. But once you're on your own and you're paying these costs, you realize what you had. And like I said, health insurance is very expensive, but you need to have it.
Now, your child has a disability, so do you get Medicaid and SSI?
And he has cancer. He's been on remission for almost 7 years. So he's doing pretty good. He's not walking though. He'll be 12 in February.
Healthcare is definitely, because when we first got off, started working, you were completely cut off of everything.
Well, they let me stay on for a year.
Did that make a big difference?
Oh, yeah, because I work for Penny Bowes, and instead of me having, they have good benefits. So when I went there, they said, okay, because you have Medicaid, let me give you extra amount of money. So they gave me extra amount of money in my check every month, almost $200 more. That's a lot extra. And I thought, oh, okay, this for 1 year. Then after I was there for 1 year, the Medicaid was lifted up. I got the best health care. Then I didn't have to pay all that health care because I was on my company here. They gave me what you call flex dollars. That means you pay less. So now, I have a child who has eczema, another who has asthma, and I will also go back and forth to doctors for certain things. And all that's taken care of. We see a private doctor to this day. And I got one child on his way to get some braces in another year. So I couldn't afford that, but my job takes care of the braces are $3,000. My co-payment is $200. And I pay a payment, so. And with that, I like to say, I'm being on this program. Last time I met you, I had just got my job, and I was living in my house. But the house that I was living in that was part of the program, I bought it. I bought my house.
I remember that.
Yeah.
I remember that. I wanted to go.
I got a chance, and I had to buy my house, and I also have my minivan that I've always wanted, and my white picket fence, and my dog named Sack.
So the program does work. The program is working. From what I see today, from where I first started, and I just wish a lot of companies would get involved into this. This will help a lot of people, and it's gonna save a lot of money for federal government.
Taxes.
Take a chance. It does work. It does work, yes.
One of the key things is that we in this community, when we started the 21st century waiver that you granted us, we signed up immediately almost 150 companies with almost 1,800 jobs. Initially, willing to hire welfare recipients, so Kansas City answered your call, and we got 2 of the first employers here.
Those are new jobs.
These are new jobs.
New jobs.
Remember, we can't place them in replacement jobs. They had to be net new jobs, and one of the first companies that we worked with was Bruce Gershon of Arrow Fabricare. And Bruce, you might want to tell them about your experience.
Well, it's been a wonderful experience for us. We've basically brought them in like we would have any other employee applying for a job, and qualified them and put them into a training program. And some of the people like Shara have moved up in their wages, and we've had a lot of successes. And it's been wonderful to see the people grow socially in the atmosphere, taken out of a welfare situation and grow within a group of people.
Has the wage supplement helped you?
Oh, absolutely.
I sort of see it as like a premium we can pay to get a private employer, not only to train people for the job, but also to train people for the workplace, the whole changing the culture. Do you mean?
The cost of turnover in any business is a huge cost, and when you supplement that for training, new people, in bringing on new people, and the cost to train people in our business, the training, depending on the job, can be 3 months to a year, where before they're really up to speed to take on a position.
And in Missouri, you can keep the wage supplement for up to 4 years, right?
The client can keep it up to 4 years. The company, for a new job, gets 10 years of wage supplement. So the person can only stay in the job for 4 years, but the company, for every new job...
If they put a person in it, they can get it for 10 years.
That's right. As long as they're keeping a welfare recipient in that job, for every new job, they can get a 10-year wage supplement, which is like what Mr. Davidson, who is one of our more recent employers, may want to address also.
Well, I want to say, first of all, Mr. President, it's exciting to have you here. And second of all, we appreciate the business that we get from the federal government that we've won on bid. The United States Treasury and the FDIC stores records with us. And thank you very much. Let me tell you the story of Jackie Galloway, who was one of the people that came in on this program. And she said, first of all, the Full Employment Council gave her training. She said, and I got my GED, and I got prepared to come and take this job. And I had a little child, and I got some self-respect now, and I started the job. And she started as our receptionist, and she did a good job there. And the way we set up our program, after you're there for 3 months, and you show up, and you do your job well, you get a raise. Another 3 months, show up, do your job better, get a raise. Another 6 months, same deal. Jackie will be there 1 year right now, and next month she'll get her vacation, and she's thrilled about that. I don't know if she's ever had a vacation, a paid vacation before. So what it's doing for people and giving them self-esteem and self-respect is just beyond counting. And we're a small business. We have 25 people, but 5 of those people are from the Full Employment Council.
Wow.
All right. That's good.
Good for you. What about turnover? Have you had a lot of turnover?
About the same amount that we would expect. For some people, it was very, very difficult taking away the structure of the check and the food stamps. And they had money that was their own, and they didn't manage it well. We had one person that her self-esteem grew so rapidly that she left the program and got another job in the private sector that wasn't part of the welfare reform, of the wage sub.
Well, what about you? You had a lot of turnover?
We've had some. Everybody, this isn't for everybody, and everybody has different problems. But the 5 that we've got working there now, I would grade them from excellent to very good. And I would be hard-pressed to say that all of my employee experience is any better than that. And it's been a wonderful thing, and like I say, Jackie's moved up to a more important position. She's our chief order taker now. She's very important. Her office is right next to mine, so very close to her.
It seems like the turnover is the highest right in the first 30 days, and we've done a lot of focus groups with the companies as well as the clients talking about what are the issues. The case management, those supportive services are really, really important. And actually, employers say that that's one of the key issues, too.
Yeah.
You know, people can be a flat tire or a dead battery away from unemployment. There's, you know, the supports that you need in your life have got to be provided to help learn how to work in the workplace.
Well, the one thing that I wanted to point out is that even if there's turnover, that the employers that have participated in this program are doing something very positive, because we are really trying to have everybody be able to tell the stories we're hearing around this table. And it's a different journey for some people than others, and it's a longer journey for some people than others. But we're basically trying to break a mindset and an almost physical isolation from the world of work. That's what Berdella was talking about, how it changes, you know, even the neighborhoods, how they work, how they function, how the kids feel. And the way this new law works, everybody, unless you have a disability, or a child with a disability or some reason, everybody has a lifetime limit of 5 years you can do this if you're able-bodied. And a limit within at one time of 2 years before you have to move into some sort of work environment. So even if there's turnover, even if somebody only makes it 30, 60, 90, 120 days, that's still a work experience they never had before. It's some touching of the world of work they never had before, and it gives you a better chance to make it the next time.
One of the things, Mr. President, too, has been the local public policy of economic development. One of the things that the mayor has done, which we just recently landed a Harley-Davidson manufacturing plant to expand in Kansas City, the first expansion that this had in its history, brand new plant retooling.
Great.
And one of the things that Mayor did was, and he might want to talk about that, is how he links up as part of the economic development team that we're on, how he encourages persons to use this incentives to hire welfare system as part of the new welfare to work issue. So Mayor might want to talk about that.
The Harley-Davidson plant actually ends up in our empowerment zone. Thank you. And so what we have developed was an agreement between Harley-Davidson and the city to hire 30% of the new workforce from the empowerment zone, which ends up being the targeted area where the largest number of our welfare recipients get public housing. So they will have an opportunity to get the training through full employment, the Full Employment Council and junior colleges, and then go into work. Harley will hire 300 initial workers, and 90 of them will come from the empowerment zone. And that's
great.
And we utilize the wage supplement as part of the incentive package, and they agreed to do it too.
You see, I think this would be very valuable, and I believe that there will be a movement, particularly of smaller scale, like 300 and down, manufacturing facilities back to urban areas in the next 10 years, because I think the property will be cheaper, and I think the workforce will be there, and I think if you have a serious welfare to work effort like this, you can really make it work. I mean, between the funds we're trying to give the cities to clean up environmentally polluted areas to make them attractive for new investments again, the so-called Brownfields Initiative, and we're going to try to triple the number of these empowerment zones, I believe that you can have this story repeat itself. It's going to change your image, Mayor, with Harley Davidson here. You're going to have to wear one of those neat jackets. It's going to be a major lifestyle change for you.
Congresswoman McCarthy, when she was in the state legislature before we sent her to work with you up in Washington, was a very strong advocate of education and also local control, and was a very strong supporter of AmeriCorps and those types of things. And her leadership has also promoted this, and we'd like for her to talk about how she had built a local infrastructure, because Kansas City is a leader in public-private partnerships. And Congresswoman McCarthy was one of the key leaders in forging those types of relationships. She may want to talk about some of those.
It's been a joy to work with Clyde and bring together our various local infrastructure programs and needs toward this kind of a success story. Not just here today, but Mr. President, Clyde has worked very closely with your AmeriCorps program as well and made it a success in our community. We were visiting with the President on our way here and pointed out Missouri's becoming a model for this kind of success story and our community in particular. Having such success stories, Mr. Davidson, Mr. Gershwin, and others, we know if we can duplicate this across our state and region and land, that in fact it will indeed mean we have changed welfare. Mr. President, under your guidance, and we're just so very proud to be a part of that team. And while I missed the State Assembly, and I was pleased to work on this at that level, I'm very proud to be there now with you, Mr. President, to see that we do make this a success story for the nation.
Mr. President, we probably have one of the thing called a Local Investment Commission, which is one of the most unique in the country, where we bring together agencies, not-for-profit agencies, foundations to work. And this is one of its major initiatives. And Gail Hobbs, who's executive director, can tell you about how we have used foundation money, local money, city money, federal money to create a customer-friendly system, which is one of the things that we have our guiding principles is a customer-friendly, community-sensitive program. And Gail might want to talk a little bit about how that governance structure, which is a real big issue with block grants, how are you going to deal with it at the local level? Because we don't want to replace the federal government with the state government. I mean, we want locally driven issues, and so that's one of the key things that she can
I think
talk
that's
about.
one of the key points is that the states can't do it by themselves either. It has to be a deepening partnership, and communities have got to be involved. With some of the things that Berdella and the other women are talking about, those come up. We have welfare moms, we have people that have been on welfare, we have the corporate sector, everyone involved. We have over 400 volunteers that work on, and Clyde's involved, the Women's Employment Council, the state welfare system, who get together and plan this. They have an investment in their community, and they have no vested interest in anything except improving their lives. And so it's not complete devolution, but it's a partnership and a deepening partnership, and I think that's absolutely critical. Clyde, we have an employment system now. Clyde's always done a great job, but there were things that he needed, and he needed the waivers, he needed to be able to work with some of the other not-for-profits. And it's interesting over the last few years, and the waivers have helped us, and now I think now you're kind of signing the bill and helping us move forward where we can really do a lot of things now as far as the community actually join together and trying to solve the problems from the neighborhood level on, you know.
Well, the primary purpose of this bill in many ways was to end the waiver process. And then to have some standards of performance for the states, so they had to actually get it in gear. But the worst mistake that could possibly be made would be to supplant what used to be the federal rules and regulations with just a state bureaucracy. Because this program has been run by the states for years. It hasn't been run by the federal government. And the states have basically had control over the benefit amount, while the federal government has set the rules governing who could qualify and making sure that people got the food stamps and the Medicaid and the other stuff. So what I see as absolutely imperative is that every state is going to have to do what has been done here. You're going to have to devolve the ultimate decision-making to community groups that involve employers, the nonprofits, and the people who are going to be the ultimate customers of this system. People are going to move from welfare to work. And this model, this kind of encounter we're having here, this is going to have to occur in every community in the country if we're going to meet the very ambitious goals of the bill. I think we can do it, but only if we do it in this way. And I would point out, 2 years ago, I went to Vermont to talk to the governors, and I asked every governor to ask me for a waiver to do what Missouri was doing, and what at that time, only Oregon and Missouri had asked to do. Now, since then, Wisconsin has asked to do this before the welfare reform bill, and one other state, I believe, Vermont in a modified way. But every state in the country can now do this, do what you're doing, and therefore involve people like Tom and Bruce, and it's the only way it's going to work.
And I think this is important. Why we asked was Clyde and Mayor Cleaver and Burt Berkeley and Landon Rowland in the corporate sector trying to figure out how to deal with this issue in the community. That's how we ended up asking for those waivers, because it was a plan, a logical plan based on information coming from the neighborhoods and the community that seemed like this would work.
The net result of all this, and people want to say, what did you get for all this local investment commission? public-private partnership. What has it yielded? To date, we have 775 people that we have put to work that are still working at an average wage of about $6.95 per hour. How much? $7.50 an hour, excuse me. $7.50 an hour. They are still working. They're not these quick con jobs that go in one day and they're out the next. And the other thing is that we have utilized a multifaceted approach: wage supplementation, classroom training, on-the-job training, job readiness training, because welfare recipients are just like people. They are not all the same. And people friendly workplaces like Mr. Davidson and Mr. Gershon, they work with the caseworkers, they work with the clients. So it takes more than just a job. It takes a comprehensive system, it takes a sensitivity, and it takes the willingness of a community to invest locally, because we couldn't do this without locals, and we couldn't do it, and the federal government can't do it by itself, which I think block grants make people work together for the benefit and leverage resources, and I think that is a net result of this initiative. I don't think, and this is an urban initiative. If you look at a lot of the welfare programs across the country, they're in smaller counties with smaller populations. This is an urban program dealing with large numbers of people who are located in areas that typically has not been the case. And so that is what has enabled us to see what the challenges are and address them. And the mayor and our state has made discretionary money available. We have a transportation program that's one of the few that takes people to work. You know,
That's
we
real important.
take people to work. City invests $400,000 a year in transportation to take poor people to and from work. You know, that's a major thing in this
That's a huge
community.
deal.
And the other thing is that the 4 years of daycare and the 4 years of Medicaid that goes to welfare recipients and all the focused issues with the clients, that has been the premier thing that they have said has resulted in them wanting us to go to work and motivate them to go out of poverty and to look at that as a choice. And also the places the employers said, give me somebody who'll show up to work, follow directions, and work as a team, and those are the things that we are focusing on in these next efforts.
Vicki, how you doing since I saw you
doing
last?
Fine. Things are going really well. I'm not sure if you remember or not, I came to the Women's Employment Network, not the Full Employment Council, but I'm on the same job. I've been there 4 years, and I started out pretty low level, and I worked myself up quite a ways. I'm now serve on the board of the Women's Employment Network, which is really exciting for me because now I'm able to help other women who are in the same situation that I used to be in. So, in fact, I work on their Special Assistance Committee. So one of the things that I get to do on a regular basis is find ways to assist other women who go through our program, because like we were talking about health care and child care, I'm like them. I lost mine immediately when I went back to work, and it was very hard. And on my job, they paid for my health care, but not for my children's. And that was the part that really hurt a lot. But one of the things that also helps a lot is one of the things that WIN does is when these women are going through, is there's other things that also get in the way of them being able to stay on their jobs. And we help them with things like if they're having trouble paying their utilities or their rent, things like that, while they're in the transition from going through a program like this. There's a lot of women who are in WIN when they're going through, they're having trouble paying their utilities or paying their bills, and they're so upset on trying to wonder how they're going to live or how they're going to pay those or how they pay their bills, or having the right clothing to go out to interviews. We spend a lot of time trying to take those barriers away too. So that's one of the other things I think, besides the major issues like health care and child care, we've got to look at the more personal level too, the things that we can help. Like just recently we had a woman who needed some cosmetic work for her teeth because she was so uncomfortable about going out and interviewing because the way her teeth looked, because she didn't think she'd ever be able to get a job. And one of the things that we did was we helped her get partial plates so that she would feel comfortable going out and finding a job. So we try at even the most basic level to help women. So that's one of the really neat things for me. Not only did I get off welfare, but I've gone places in my job and been able to succeed and buy a new car and buy a new home and all that kind of stuff. But now I'm actually able to, on the board, actually go back and help other women. So I think that's a really good thing for me that I've been able to do that.
Pay taxes, like 1% banks tax.
But that's a wonderful story. let me just say again, I mean, I know I'm beating this to death, but it's a point I want to make to the American people. The act I signed is the beginning of welfare reform. What it does is it creates very strong incentives for every state to, in effect, empower communities to develop community-based systems like this. There is no way even a state, much less a national government, can know how much money any community needs to for transportation. That depends on what the facts of the community, much less whether there should be a program for helping people with their dental or clothing needs or anything like that. This has got to be pushed down to the grassroots level where community people who care about their community and care about the people that they come in contact with as individuals can fashion solutions that will work. And I think now you've got the tools to do it, and we just got to make sure we do it right. But it's, I just wish everybody in America were as far along as you all are. And I want to say a special word of thanks to Tom and Bruce, too, for participating, and all the other employers that you represent here today. My instinct, I have two feelings about this that a lot of the skeptics who, were worried about me signing this bill didn't. I believe the business community's response will be overwhelming because I think most people in business would like to end the way the welfare system has worked and would be willing to do their part in doing it. That's what I believe. I think most business people will stretch a little, especially if we're at least sharing the cost of early training and development of work habits. And I have hardly ever met anybody on welfare who did not want to get off once they believed that they could, So you all have strengthened my faith and optimism.
Well,
Mr. President, my dad taught me that, I think it was a saying by Tolstoy, and it was not politically correct, but it said man's greatest blessing is his work. Maybe he meant mankind. And I've always remembered that, and it's always been an honor as an employer to be able to provide work. So I thank my dad for Mr. Tolstoy.
Thank you.
We want to thank Mr. President for coming and being supportive, and thank you very much and appreciate your support.
And making this possible.
That's
and
right.
more possible in the future.
Now, in the next couple of days, when people all over America start calling you and wanting their addresses and everything, I don't want you all to be put out with me. I want you to help them do just what you do.
We'll keep moving.
We'll do it.
Keep moving.
Thank you.
Thank you.
What?
Follow up on something you mentioned.
Yeah.
Senator Dole says on the family medical leave that it's another example of big government meddling where it doesn't belong. Whether we agree to the theory of the argument.
I just disagree. I mean, look at the evidence. 12 million people have taken a little time off when the baby was born or when a parent was sick, and small businesses are exempt because of the problems with work schedule. And the American economy has been growing like crazy since we passed the family and medical leave law. We've had a record number of new businesses started. We have had 10.5 million new jobs. There is no compelling evidence that this has been bad for the economy. It's anything you do that helps people to succeed at home and at work is a good thing to do. That's basically what welfare reform is all about, and it's just what Tom says. We've got to find a way for every American to have a chance to succeed at work and at home, and that's what family and medical leave is all about. So I just respectfully disagree. I think we were right to do it. I think those who opposed us have been proved wrong by the evidence, and I think the very modest and limited expansion, it's like anything else, you could overdo it, but we're talking about a very modest and limited expansion directed toward helping people go to their parent-teacher conferences and go to regular doctor's appointments. It's not a big radical step. It's pro-family and pro-work. Thank you.